A study is described as a scientific process for answering questions using data from populations. Ecological studies compare health metrics across groups, aiding in the generation of future research questions. Case control studies start with individuals who have a disease and compare them to those who do not to identify risk factors. Cohort studies involve following a group over time to assess the effects of exposures on disease development. Interventional studies assess the impact of an intervention, such as a medication or health advice, on outcomes. Systematic reviews and meta-analyses synthesize findings from multiple studies to provide a comprehensive evidence summary. Each study type has specific challenges, including costs, ethical considerations, and participant retention. Understanding study types is crucial for researchers in selecting the most appropriate method to answer their specific research questions. Each type serves unique purposes, from generating hypotheses to testing interventions. While ecological studies can provide broad insights into population health trends, they may lead to misleading conclusions about individual behaviors. Caution is necessary when interpreting findings, as group-level data cannot be directly applied to individual cases. The design of case control studies allows for the efficient examination of rare diseases. However, researchers must ensure that the controls are well matched to avoid biased results. This approach can highlight potential associations but does not establish causation. Cohort studies are particularly valuable for understanding the temporal relationship between exposure and disease. Since they track participants over time, they can provide insights into how risk factors lead to health outcomes. Randomized controlled trials are considered the gold standard for evaluating the effectiveness of interventions. The randomization process minimizes bias, ensuring that differences in outcomes can be attributed to the intervention rather than confounding variables. Systematic reviews are essential for distilling large volumes of research into actionable insights. They ensure that healthcare decisions are based on comprehensive evidence, thus improving patient outcomes and informing public health policies. Meta-analysis strengthens the evidence base by combining data from various studies, increasing the statistical power, and providing a clearer picture of the effects of an intervention or risk factor across different populations and settings. By understanding these insights, researchers and public health practitioners can better design studies, interpret results, and apply findings to improve health outcomes within communities. The video ultimately underscores the complexity of epidemiological research and the importance of rigorous study design in shaping health policies and practices.